treat this lesion?
We will probably have to stent this lesion.
Dr. Mark and Dr. Nicholas, could you share more about what you do at NUHCS?
Hi, Nicholas.
Yeah, so I'm Nicholas. I'm an associate consultant at NUHCS. I'm a clinician scientist, interventionist over here, and our job here is to treat coronary artery disease through percutaneous interventions.
Hi, I'm Mark Chan. I'm a senior consultant at NUHCS and also a clinician scientist, and like Nicholas, also an interventional cardiologist.
We heard that both of you were recently involved in a research paper. Could you tell us more about it?
This study of ours was published in the European Journal of Preventive Cardiology, and in this study we used the global burden of disease data set to look at the forecast trends of cardiovascular disease in the next 25 years. And with this, we had several surprising findings. We would expect that cardiovascular disease burden would be on the decline with the advancements in medical care. But the contrary is true, where we have found that the increasing burden of cardiovascular disease would double in the next 25 years. And this is something of concern because this will be the burden of our future healthcare systems that we'll be facing, especially with our aging, growing population. So the major drivers and culprits are really the high blood pressure. Number 2 would be poor dietary factors. And number 3 would be high cholesterol. So these are the upstream factors that are driving this burden of disease in the next decade, in the decades to come.
So this coronary angiogram that you see, which Nicholas and I were just discussing, how to treat this patient, is, I think, highly relevant to this discussion. And to give you an idea of what we are actually looking at, this is a patient's coronary angiogram showing a high-grade blockage, and this is, as Nicholas said, the commonest cardiovascular disease called ischemic heart disease. Here you see that the coronary artery is of a relatively normal caliber, and then it tapers to a very high-grade severe narrowing. This is arteriosclerotic plaque and cholesterol laden plaque that's causing a tight blockage, causing the patient to have chest pain. And this is the types of cholesterol plaques in the coronary arteries that lead to heart attacks. So Nicholas' study is particularly important because it tells us that the incidence of cardiovascular disease is going to increase dramatically over the next 25 years. And the commonest disease that's going to be affecting us over this future period will be ischemic heart disease and its consequence, which are heart attacks. It does indicate that we really have to tackle these 3 main root causes of elevated blood pressure, poor diet, and elevated cholesterol as early in life as possible. We have the Healthier SG program in Singapore that offers free screening, but if you are detected to have elevated blood pressure or cholesterol, don't just stop there. Listen to your doctor. Besides having a better diet, your doctor may ask you to take medications to treat these risk factors. These are safe as well as highly effective medications that will then prevent you from having coronary artery disease and heart attacks. So congratulations, Nicholas, and I think your research really has very strong implications for healthcare in Singapore.